Let me invite Dr. Darshana Abeygunawardana and Dr. Shiromali Disanayaka and Miss Edna Mokaya to the stage. And let me introduce Dr. Darshana Abeygunawardana. Dr. Darshana Abeygunawardana is a prominent obstetrician and gynecologist serving as an honorary senior lecturer at the University of Sri Jawadanapura, Secretary of the Menopause Society of Sri Lanka. He is involved with the South Asian Federation of Obstetricians and Gynecologists and the Sexual and Reproductive Health Committee of the Asia and Oceania Federation of Obstetrics and Gynecology. So the first question we have, Dr. Darshana, is what are the common menopause-related issues among Sri Lankan women?
To initiate with the discussion, I think we need to know the woman, who is the woman we are referring to. The woman at midlife, I think having dedicated her life over decades to her own family and the society and for the development of the country. And now she is passing through a very transitional phase in her life, and so still she's contributing to the development of the society in the country and looking into her contribution. So when we go through the statistics, and we know the female workforce is, according to the statistics on 2023, and the female workforce is somewhere around 32%. But actually this is not the figure we should refer to. Actually the majority of women actual contribution or their dedication and to unpaid domestic and the care work, actually we didn't calculate this one to that figure. And at the same time, so even the older women, they remain very active in their extended families. They do take care of their grandchildren as a caretaker, actually. And this is another one aspect. And the other aspect is, say like when they come to this age, many women are in very key positions in the hierarchy. Maybe in the private sector or in the government sector, they hold very higher positions. And they contribute still, then this is very vital. Their decision making and their service management is very vital for the development of the country. And then the question is whether we are giving something back to them to meet their demands. So unfortunately, we have very limited number of research in this field, in Sri Lankan context. If I consider a recent, I think that was done, there's a cross-sectional study was done in Sri Lanka, and about 680 women was participated, and there it shows the prevalence. And I think prevalence of more than 90% had one or few menopausal symptoms. But the thing is, the most prevalent menopausal symptoms was the joint and muscle discomfort, and then it roughly counted for 75%. And physical and mental exhaustion was seen in somewhere around 55%. But actually, hot flushes were seen only in 40%. That may totally, be different when we compare some studies in UK and the European society, and that will basically counted for more than 80-85%. I don't know, difference maybe because we are in a country in the equatorial region, so then we are very used to this hot weather, and the woman will perceive this as a normal thing in their life, and because they were used to. Maybe even the cultural differences and even the dietary habits. All in all, so this is the situation in the country. That we as a menopause society, we had a recent study to understand the health issues in this population, and that was conducted a year back. So then during this study, we realized, and when we start the study, actually so 65% of women had one or more non-communicable diseases. And then at the end of the study, so we realized dyslipidemia was found in 71% of the population. That's a huge. About 68 to 69% had hypertension, and the diabetes in 30%. So when we consider the osteoporosis, major osteoporosis risk and the hip fracture risk, somewhere around 26%. And metabolic syndrome risk was 65% again. So then if you realize these findings, figures, then you can understand the implications, health implications, what is going to happen in the future. So there will be a very big impact. Same time, so then even this population is going to face it so many problems. I think to address these issues, there are so many barriers and the restrictions in Sri Lankan context. And the main one is, I think, the awareness, poor awareness. They are not aware of these menopausal symptoms because either maybe unaware, they are not aware of these symptoms, problems, or maybe negative attitude, or even socio-behavioral problems, restrictions, or stigma behind these. So, but when we compare a woman in European country and Sri Lanka, it's totally different. So, what happened? Women in UK, if they find perceive a menopause as symptoms, they will quickly go to a doctor. They want to take immediate advice. But unfortunately, in developing country situation is totally different. They don't want to perceive, and they don't need to go to a doctor and have a treatment or have advice. So then if they go, they can prevent most of the preventable complications at the very beginning. But unfortunately, this is not happening. And the other thing is a social stigma. Maybe some are reluctant to say that they are menopause, and some are not. And the other thing is the negative attitudes. And the other thing is sometimes they don't want to go for medical advice. Maybe due to economic crisis, they may have some restrictions. And then as a government is not in a position to provide hormones, very freely. So they can't, out of the pocket expenditure is very high, so then for this HRT, and they don't want to go for. These are some issues. And then the other thing is the access to healthcare facilities. When we consider it being in Colombo, that everybody will say, no, you have a very big access. But if you go to a periphery, that will be the other way. And so it's not equally distributed. And the other thing is we don't have support groups. And if we have a support groups, I think, that they can share their experiences and advices. But unfortunately, we are not in a position to have such groups. I think these are the problems related to menopause in our country.
So what initiatives have the government, Sri Lankan government, taken to mitigate menopause related issues? Do we have such things?
Very less to talk on. This regarding actually, I think government is trying, but anyway, they don't know what to do, I feel. And because most of the resources are going to be wasted. Actually, so we as a menopause society, we suggested menopause task force. So what our intention was to, make a team spirit, and, they can take decisions and they make policies, and then they can create a favorable environment for these women in the country. But it was initially agreed upon, but anyway, so unfortunately, it was not implemented. And the second one, we as a menopause society, we wanted to start dedicated midlife clinic. Actually, we made even the health record is also finalized. And we wanted to initially start this as a pilot project in 5 hospitals like Ragama, Kasal, Kalubovila, Kalutara and Homagama. But so all in all, but we couldn't still start yet. But we did some programs. We wanted to educate the stakeholders and the medical professionals who are involved in these clinics. And then we conducted one clinic at Kasal. And what I can say, only clinic which I know is the Well Woman Clinic. That was initiated in 1996, and I think there are about 1,000 centers island-wide. And but unfortunately, the target group is 35 to 45. So we really suggested to increase it to 60. But unfortunately, anyway, so they are going to say yes, but anyway, they're still not implemented. And they do in these clinics, they do some screening for NCDs and then some common cancers. There was a recent development. I think they wanted to include menopause rating scale into these health records. But I think it's a good initiative at least. And so Well Woman Clinic, so we can make use of it, but anyway, so we need to modify it in my personal view. And the other one is I think currently we don't have much, but there are some programs run by Menopause Society. It's not because I'm representing the Menopause Society, but actually we do a lot, and we have very good feedback, and we are in that ground, so we know awareness is the main problem. So awareness wise, it may not be the stakeholders or a medical professional. We have to make aware of this public. So we do conduct courses for the pub separately. We do conduct courses for the health staff separately. And I think more than many number of programs have already been done, and there's a very good feedback this, because so we can on an open discussion about this topic can change the stigma behind this topic. Then everybody is free to talk on that, and otherwise what happened, they are going to be scared, and then here even the partners are going to be in these meetings, and then partner is going to have some sort of awareness. Okay, this is a normal thing. I mean, we need to the help by our partner. something like these programs are very helpful. And other thing is, I think, other than those things, there's no any initiation by the government. Yeah.
Okay, moving on to the final round of questions. This is to Dr. Darshana Abeygunawardana. What policies and programs should be incorporated into a country's health system to address menopause-related issues more effectively?
Answering this question, I think I was discussing about the issues in the first, and we should find out these issues, and then we should find the options how to mitigate and all these issues. The awareness is the main problem, so we all realize that, and I think awareness, as I mentioned, so we should have a program to make everybody aware of this, and we should have some short-term and the long-term plans. Short-term plans is we should educate our service providers, especially at the set of ground levels and at the primary healthcare centers, and we can educate them how to perceive the menopause and how to receive the lady with menopause and how we are going to advise, and then the other strategies, curative strategies. And the other thing is, in the long run, I think we need to include this menopause module into undergraduates, postgraduates, and then midwife and the nurses at their levels, different levels. So we need to address about these problems, and so we can include these modules. And the other one, we can educate our teachers, school teachers, then we can make a teachers training module. So we should have a sort of a policy. The awareness campaign or programs will not achieve all these. We need a big backup from the ministry and the ministerial level. So if we can have a sort of a women's health strategy, the plan or a strategy for menopause as a policy, drafted by the government. So then we can, according to this policy, we can do something. Then we have a sort of a backup from the ministerial level. That's very necessary in a country like us. And the other thing is, I think it is probably good if we can have a separate directorate, because adult directorate will not address issues in menopause. And if we can have a separate directorate, I think that would be very helpful for us to manage menopause related problems. And the other thing is, now we have very less number of studies and research on this topic, so we should promote. Actually, so our founder president wants to the promote this research activities on this, and I can mention even he I think he gave the 200,000 rupees to the society. That is only to support anybody who is doing research on this topic. I think that's a very good initiative. I think he has found it, the need for the day. And so then we should promote research and studies. And the other thing is, we should have a dedicated clinic in the sense of if we can, the government can support this midlife clinic. So then to initiate and the maintenance is really important. So that would be very helpful for us to address this crowd and the population, and then they can come and receive this, they can discuss these things with us. And then the access, and everybody should have the access to healthcare facilities. I think it's not only in Colombo, not in town areas, even in rural areas, the same access, free access should be available. And the other thing is social stigma. So we can change, we are going to discuss this very freely in forums and the open discussions, and then we can make it something like a very free thing in their life and the normal thing in their life, and so then everybody is very free to discuss any problems. And the other thing is the support groups, and I think this is very helpful. We have realized, even being a medical professional, so if I say something to a female, even to you, say like, you can think, anyway he is a male, how come he knows about this menopause? If I can get a help from another colleague, say that who is passing through this life, and then they will realize, okay, kind of very good sort of, that's provocational, that sort of attitude. And I think this support group has to be created. And the other thing is, all in all, we should provide them with menopause hormone therapy. At least if government can't give it free of charge, at least at a low cost. And so that also will be very helpful, because there's an economic crisis still going on in Sri Lanka. These are some of the initiatives I think which I plan, and then we as a menopause society. And the other thing is, we should use the media. I think we are doing that. So media now, they are the giant behind all these. They can make black into white into black. So then, especially with at the hand of these uneducated people, they play, like nothing, no. So we use this media in a professional way, in a good way, to get this crowd and then to educate them. And I think this is the need in the country now. And I think these are the things I propose to uplift the life of midlife women. I think if we do this, I mean, the ministry has to invest. I mean, even we know this is our goal, SDG goal, I think 16 or 15, I can't remember. It says everybody should get the equal right for medical, the access. And if government is going to invest in this, I think it's not a waste. I think it's an investment, because we can reduce this lot of health implications in this crowd, and then we can get them into the productive life, and so then will be the development of the country. And so we can fight, we can make a resilient, the sort of environment to fight these health issues, and we can make a good future, because these women, again, our future, I would say, because according to the population projections, there will be like more than 30% in this age, post-reproductive age. Now it is only 25%. In 5 years, 10 years times, it will be more than the 35%. Thank you.